The public is now being prepared for what looks as though it's going to be a massive rise in cancer cases, especially in young people, and they're being prepped in order to help them to not make a connection between the obvious question. Now, there is a trick to the way how this works, and I was just reflecting on it, and I thought I would show you how this actually works. Now, the first thing you have to realize is that if you haven't heard me talk before, you will realize that I always make reference to the elephant in the room. Any change that occurs at the moment globally has to reflect the question about whether or not it could be connected to the elephant in the room. There's a real anxiety about dealing with that. And so, what you will find is that any reference to it is pushed away. And I'll show you how they will guide the public to not make the connection. And I'll use a paper that I'm going to show you in a minute about colorectal cancer incidence trends in younger versus older adults. It's an important paper that has recently come out, and I think that it helps to set the strategy for how this actually works. And I'll just show you, give you an idea as to what you can expect to see over the next few months and years as there comes a realization that there is a problem. Now, for anyone who has been following me, you will know that I have been predicting this for some time. So much so that there is a whole presentation that I have done that you can join me on. And I look at all of the factors in terms of what is just a general overview of cancer, immunity and cancer, how it's connected to COVID, IgG4, interferon suppression, P53, SV40, all of the things that you will not hear about normally. So if you want to hear about that and learn about it, please look at the link below. Before I get into it, though, as usual, as a reminder, please remember that we have just launched Disease X. Are you prepared? As you can see, this is fresh, still number one bestseller in viral diseases. And guess what? We even got our first 5-star review. And it is a great review. 5 stars, comprehensive guide, essential resource for preparing you, your family, and your friends for the next major pandemic. This is from a John Funk. Really appreciate it. Dr. Macmillan's dedication and expertise shine through, offering clear explanations, actionable advice, and a compassionate perspective on navigating uncertain times. So, yes, if you are willing to join this journey, please, there's a link in the description below for Disease X. And please put in a good review. It really helps us to get this out. So, let's get back to what caught my attention, and I'll show you a bit of insight into how this trick works. So, the first thing was this paper or this article was published on the 17th of December. That's today. Doctors issue warning of three new factors driving certain cancer type as cases skyrocket in young people. That's the first trick because this is making you think that this is updated information. New research has revealed the possible cause of the surge in cases. Now, everybody who is thinking about it realizes that, yeah, we have been seeing a surge in cases. What is going on? Well, they go on to explain that it's not what you think it is. It has nothing to do with the elephant. Guess what it's connected to? It is connected to, yes, pesticides in food, toxins in drinking water, and air pollution could potentially be the cause. Now, you would think, how in the world did they come up with this and not include anything about the pandemic? Well, this is where you'll get caught out. And this is why I said you have to analyze this a little bit more and realize what the tricks are. Because what they're trying to do is trap those people who would say, oh, this is because of the elephant. And then they come out and say, well, actually, This research was not related to that time. That's the important trick. So look carefully. This is the paper here, Colorectal Cancer Incidence Trends in Younger versus Older Adults, an analysis of population based cancer registry data. So, this here was looking at the colorectal cancer incidence in younger adults, less than 50 years, in multiple high income Western countries. And so they were looking through this period of time. And what you have to look for carefully is what was the year that they were doing it as. And so they were using a 5 year period up to 2017. So that is pre pandemic. And so they are looking at a period pre pandemic, and their interpretation is early onset colorectal cancer incidence rates are rising in 27 of 50 countries. Now, follow me carefully here. This information is related to time up until 2017. So you would ask yourself, well, oh, I guess this research has been in the background for some time, and they were working at this, and finally it gets released, and so okay, maybe that's why they're talking about it, because it makes no sense to me that you would talk about rising cancer and not include the pandemic years. That makes no sense. And if anyone has been following my research, and I'll show you what I found, you can't get this information anywhere else. And I'll show you what I found at the time. And once I started sharing it, it seemed to disappear. And this is essentially what I found when I looked at number of cancer patients receiving first treatment. I was interested in first treatment because I knew that would mean that the diagnosis of cancer was made and they hadn't yet died, because depending on the age of the person would determine what the mortality was. But 2020, 2021, 2022, 2023 at the time is in the dark blue. 2020 is light blue. And you can see all the way through 2023 was the highest for first treatment. This is UK statistics. After I shared this, it seemed to disappear. So you can't see that data anymore. So I happened to collect it at the time, and it's part of the presentation. So it's important to note that it appears as if this kind of information is not considered convenient. And so, therefore, you don't really have access to it. But here is the question that I would ask those people who were doing this research, because if they only published up to 2017, when was this research done? Because we have data up to at least 2022 in terms of international cancer registries, because they sometimes wait a year or two before they publish the full data set. But we're now in 2024, so we definitely have all of the information up to 2022. So they could have done 2017 to 2022 as well, but it would have been skewed by the pandemic, but we would then be able to understand trends. But here is where I realized that this had to be more than just the fact that they started this some time ago. If you look carefully here, they searched PubMed articles from the 1st of January 2000 to June 30th, 2024. June 30th, 2024. What that means is that the research had been started after the date of June 30th, 2024. This paper, you have to realize, was published in the Lancet in December of 2024, just so that you can see that I'm not making this up. And so you can see the information. Here you go. December 11th, 2024 is when it was published. And they did the search up to June 30th of 2024. That means that they did the research within the past 6 months and only looked to 2017. For me, that makes no sense whatsoever. And it's unlikely that they haven't done the research up to at least 2022, because that's available. but they're not publishing it. Not yet. They need to prepare the public for the fact that there seems to be a significant rise in cancer, and this is just part of the normal trajectory. That's essentially what you're going to hear. People are going to say, well, cancer cases were rising anyway. It was raised with pesticides and toxins in the water and so on. That's the cause. It has nothing to do with this elephant in the room. That's essentially what it seems as though it's all about. Because if it wasn't anything to do with the elephant, it would make perfect sense to just talk about it in relation to what is happening. There's a reason why I'm sure about this from a scientific extrapolation. And the simple point is that when I spoke about the course, there are multiple things that I covered that could be relevant in terms of this. But there is just one point here that I will highlight, and sorry, so that you can see it. One point here that I will highlight: interferon suppression. And interferon suppression on its own is a critical factor. A lot of people don't know that part of the immune system, because it's the immune system fundamentally that deals with cancer. There are many other factors, but immunity has to fail in order for cancer to occur. And one of the important parts of the cancer protection in the body is interferon signaling. And this is how, or one of the pieces, one of the facets of how the immune system fights against cancer. And there is no doubt that interferon is damaged by the elephant in the room. So the numbers are suggesting that this is inevitable. But there is such a determination to put aside science, objective science, and just look at the facts and come to a conclusion. This is what happens when finance and politics gets mixed in with science. We're stuck. And at the moment, it means that fundamentally, we are not going to get the answers that we need. Look at the numbers again. This was from 2020 to 2023. As you can see, consistently, first treatment in 2023 was the highest it had been. This is from January to August. I had to go at that time because by September, this information had disappeared. But it had shown that this was relevant in 2023, and I have no doubt that it would be relevant in terms of 2024. You have to learn the tricks of the trade. And this is how it's going to be done. And that's the answer you're going to hear from the general public who is not aware of these strategies. They will say, no, you are wrong. All of the science tells you that it's because of pesticides and toxins and all these other things that were there before the pandemic started. They will not acknowledge that the trajectory has probably changed significantly afterwards. Or if we're lucky, we may get a chance to see the data and be able to look at it ourselves. We'll continue to keep you updated. Remember, support Disease X. Try and make sure you get your book and help us to keep this at the forefront over the next few months. Have a great evening.